One of the best experiences I had when I was training to be a therapist was my training in EMDR. EMDR is eye movement desensitization and reprocessing therapy, which is originally designed to process trauma when the client is invited to think about their trauma, something that is unpleasant for them to go back to in their memory, and then move their eyes left to right. Either you use a finger or a pen or a light, or for online work there is specific software that helps the client experience the eye movement and helps them with it on the screen. So when I was training to be an EMDR therapist, and for therapists we are usually experimenting first on ourselves to also know what the client is going through when we are administering or walking a client through a technique. And for me, of course, I had my adverse events in my history. I don't have any specific trauma, but as every person, I have difficult experiences, and sometimes I notice that these past experiences impact the way that I get triggered or impact the way that I react to my normal circumstances, which I don't like because I don't like being not in control. So during that EMDR session, the EMDR training, I was invited to think about those adverse experiences and process them with the use of EMDR. A colleague, a co-trainee, was helping me process those experiences. And the funny thing and the beautiful thing in that was that what I noticed is that normally when I would go back to that adverse experience, my brain would follow a specific script and would focus on specific aspects of that situation. And what EMDR processing does is it forces your brain to process that event in a different way. So what I noticed was happening was that I was thinking about the same event, but looking at it from a different angle. And that is the element that is healing in EMDR therapy.